38-year-old with HIV presents with 5 days history of feeling unwell, and typically you find a radiograph which is showing a consolidation. So what is the cause of consolidation, which is lobar, in case of an immunocompromised patient? So don't jump to a conclusion of pneumocystis. The pneumocystis is also seen, it generally leads to an interstitial pattern rather than a lobar pattern, is what you need to basically remember. That's the reason streptococcal pneumonia is the most common cause for the lobar pattern of pneumonia in a community acquired setting, even in an immunocompromised individual, is what you need to basically remember. 61-year-old comes to the emergency department and he had been on multi-drug therapy. And what is ECG showing? All the classical features of hypokalemia, presence of U waves, right? And how is the QT interval? Long QT. All hypos lead to lengthening of QT interval. Last time you remember in DNB medicine we have discussed on last before Monday. All hypos lead to development of lengthening of QT interval. What is QT interval? From the beginning of the Q wave to the end of the T wave is called QT interval. So normally it is supposed to be less than one large box. Sorry, less than 400 milliseconds. You have got 2 large boxes. But if it is longer than that, then that is called as prolongation of the QT interval. And ST segment depression is another important feature. ST segment is typically depressed. So presence of U wave after T. So they are all the important markers. So what is the reason for this patient developing hypokalemia is an important question. He had been taking thiazides. Thiazides or thiazides. Thiazides retain calcium, loop diuretics lose calcium. But when it comes to potassium, both of them are caloritic in nature. That is what we need to basically appreciate. Now doctor, 45-year-old from Chennai has got a loin pain and hematuria. And his father also died with brain hemorrhage. And his imaging has been shown. What do you see in this? Polycystic kidney disease. And why did his father die? Because of the subarachnoid hemorrhage, because the rupture of the berry aneurysm, which is often a feature of polycystic kidney disease. So what is the chromosome number? Chromosome number 16 is what you need to basically remember. Both are possible, but generally ADPKD1 gene is basically 16, and that is most common. That's the point. Tomorrow you have a very refreshing session in pathology. There are totally 442 questions in the last 15 years in DNB in pathology. Dr. Kulkarni is one of the eminent pathologists and very passionate teacher. He is traveling all the way from Gulbarga to Hyderabad to deliver the review of, there are totally 28 topics in, 32 topics in pathology. If you read those 32 topics, 85% question paper in pathology in DNB can be answered. Examiner has no other choice but to give from those 32 topics. First you need to know what questions were asked in those 32 topics and then slightly expand on those 32 when you prepare personally and crack the exam with confidence. And on Tuesday I will be reviewing, there are 41 topics in SPM. Totally 560 questions analyzed in last 15 years. Just you read that 41 topics, out of 25 questions in DNB CET, 22 to 23 questions you can crack simply like that. And such a great recurring pattern of questioning examiner is, we have completely made it a striptease and said boy or girl so clearly if you analyze. Otherwise, if you look at volume of questions, you feel, oh, so much is there to read and you will never read. But you analyze, dissect them, group them into topics, a typical war strategy. Group them and kill them is what you need to basically do. Now, doctor, so Monday will be pathology, Tuesday, Wednesday will be SPM, we will finish DNB. Now, 45-year-old presents with headache and low libido. Eat well, sleep well and come. Morning 9 o'clock to evening 7:38 is a stamina session for you and also for the teacher. With headache and low libido, there is, he is found to be hyperpituitary. Neuroimaging, what is it showing? It is showing a pituitary tumor which is encroaching onto the optic nerve, optic chiasma. So optic chiasma is at the great risk of injury is what you have to basically appreciate. A 16-year-old girl comes with streptococcal throat infection and she has got abdominal pain and joint pains. And what do you see in her? There are typically palpable purpurae, which is classical of Henoch-Schonlein's purpura, which is the other end of the spectrum of IgA nephropathy. That's the reason elevation of IgA is what you basically expect. We invite Anu, Srinivas, students of Secunderabad, and we have in fact a large number of students from Gandhi Medical College, and Gandhi Medical College has become like a hub in Hyderabad for preparation for MD entrance. Means join in a hostel room, enroll in a reading room and subscribe for a mock test program and only think directly Bashir Bagh to where? Some city in America with B. So Bashir Bagh to Boston. No, it is not in Bashir Bagh, no, Mushirabad. Mushirabad to Massachusetts. So kind of a hub it has become. Earlier Nampally and Koti used to be like that in Hyderabad. But anyway, these are evergreen areas. So fundamentally it is a competitive ecosystem we should live with. Otherwise the comfort zone of mom, dad, brothers, everybody pampering us, we don't get the drive. Fighting spirit will only come when we are sitting with the people. Yeah, that's how we are spirited every week to be with you. And feeling like the next exam is my exam is a feeling I'll get every time I set a paper. A 28-year-old with recurrent nasal bleeds, and on the right hemithorax typically there is bruit which is being heard. So classically it's an example of hereditary hemorrhagic telangiectasia is what you have to basically, also called Osler-Weber Rendu syndrome is what you need to remember. 31-year-old presents with the lesions which have been shown to you. Classically these lesions on the upper eyelid are in the trigeminal distribution are that of the herpes simplex, not zoster. Herpes zoster, chicken pox in childhood become reactivated as herpes zoster. Simplex is different. That's what you need to understand. Then doctor, 72-year-old, 2-month history of poor appetite, intermittent fever, night sweats, benign prostatic hypertrophy, has undergone TURP. After urological surgery, if there is a development of infective endocarditis, what is the most common cause responsible? So we should suspect possibility of Enterococcus faecalis as the most common bacterial endocarditis. Following a urological procedure is what you have to basically remember. Very happy to see our Guntur students who are very competitive and many more. 75-year-old with a transient ischemic attack, type 2 diabetes, and ECG is being shown in the figure. What is this? Atrial fibrillation. By now you know all the classical ECGs. Around 10 to 12 ECGs are there, which are repeatedly asked, more or less the same things will be asked. So atrial fibrillation, CHAD-2 score. What is that in atrial fibrillation? It is a score which tells the probability of developing a stroke if you don't anticoagulate. To know whether a patient of atrial fibrillation require anticoagulation or not, lifelong, CHAD2 score is what you have to basically remember. Then 21-year-old with hematuria recurrently, renal biopsy shows a typical mesangial proliferation and also immunofluorescence showing IgA is a classical example of IgA nephropathy. It follows a sore throat. It is the most common cause of recurrent benign hematuria, isolated hematuria. That means urea, creatinine, nothing is elevated, only hematuria will be found. It's called sympharyngitic hematuria. Immediately after sore throat, within 48 hours, there is a development of hematuria, is what you have to remember. Then doctor, cerebrovascular accident is there, neuroimaging has been done. What do you see in this cerebral angiogram? Typically, in the posterior circulation, the posterior cerebral artery on the left side is typically obliterated, is not showing continuity. So, left posterior cerebral occlusion. What are the clinical presenting features is a very important question. So, typically you may find the presence of homonymous heminopia, and where do you find the Wernicke's, doctor? Whenever temporal lobe is involved, that is not involved in posterior cerebral artery occlusion. So then there can be visual hallucinations and thalamic syndrome, severe excruciating pain. Dejerine-Roussy syndrome is the other name given for the thalamic syndrome. Then Claude and Weber syndromes. Weber and Claude are typically whenever midbrain get involved. So fundamentally posterior cerebral artery is a branch of basilar artery. How is basilar artery is formed? When two vertebral arteries combine to form a basilar artery. So basilar artery forms the backbone of brainstem, which has midbrain, pons and medulla. Uppermost part is what? Midbrain in the brainstem. So the basilar artery or the branch of it, that is posterior cerebral artery, gives blood supply to midbrain, the uppermost part of the brainstem. That is the reason midbrain nuclei can get affected. How many didn't understand? Honestly. Sure? Understood? No. Okay. No. It's my duty to, I think those who are attending our regular classes, Dr. Ramakant is one of the excellent anesthesia teacher. Yeah. Now doctor, you have midbrain, pons, medulla. Okay? ये दोनों vertebral arteries combine to form basilar artery. I am talking the lateral aspect of the brainstem. Think that you are looking at the brainstem laterally. Then that divides into what? Posterior cerebral artery. So basilar artery directly can give branches to midbrain, or posterior cerebral artery can give branches. So whenever posterior cerebral artery is affected, then what will happen? Weber and Claude, which are the midbrain lesions, will appear. So what is Weber syndrome, Claude syndrome, Parinot syndrome, North-Nagel syndrome, Benedict syndrome, what else? Hoveli syndrome, Miller-Gubler syndrome, lateral medullary syndrome of Wellenberg. You have to, doctor, polish it, right? This session is too short for all that, but already we discussed it. Oh, since ages we are discussing it. You have the video in the anatomy-to-medicine.com video library, brainstem syndromes in neurology. Half an hour, 45 minutes, you will become expert in brainstem if you review that. Now 26-year-old epileptic is admitted with temperature and rash. She had been on carbamazepine and valproate. The physical examination findings have been shown. So what is this lesion most likely to be? Typically is an example of Steven Johnson, otherwise called toxic epidermal necrolysis, which is common whenever you happen to take the anti-epileptics, is what you have to basically remember. Then doctor, what are the imaging features that you are seeing? Classically, corpus callosum is showing hyperintensities. Generally, corpus callosum gets blood supply from both the hemispheres. It is unlikely to suffer infarction. Generally, if infarction is there, you will find this kind of opacities. But corpus callosum doesn't suffer any such opacities. But if corpus callosum shows opacities, what does it mean to say? It is not infarction, but it is demyelination. So, only multiple sclerosis can be responsible for an opacities like this in the corpus callosal area, and they are called Dawson's figures, is what you have to basically remember. So, whenever Dawson finger is there, that is characteristic. They are ovoid hyperintense lesions, and ring enhancement of these lesions is seen whenever you pass the contrast, is what you have to basically remember. Urethritis, red eye, and a lesion is being shown. What is this called? Keratoderma blemoragica is the name which is being given for it. And typically Reiter syndrome. What does Reiter basically involve? Metatarsophalangeal and interphalangeal joints are the ones which are frequently involved. One of the favorite question of the examiner: what are the only two arthritis that involve distal interphalangeal joint? Psoriatic arthritis and osteoarthritis are the only things that involve the distal interphalangeal joint. Once more, what characteristically is involved in rheumatoid? Which is monoarticular, which is polyarticular, which is oligoarticular among the arthritis, all that approach to arthritis. You have to be 100% sure, doctor. Definitely one question is bound to come. Now what is the condition which is being shown in the figure? It is, yeah. Previous question. Yeah, please, doctor. बताइए. हाँ? See है? कोलाइटिस नहीं है मेरे भाई. आर्थराइटिस, यूरिथ्राइटिस, यहां कोलाइटिस दिया ना, that's how it is wrong. Accepted, sir? Huh? Huh. Right. I was still punching the questions at midnight, 1 o'clock. How do you think your Sunday paper will come? Simply it won't Zoom come. As much you labor to prepare for the today's exam, we labor to frame the questions. Suddenly a WhatsApp message zoomed from our students. Then I thought, okay, let me add a little adrenaline that you are not only awake, we are also awake in setting the paper. So it's a pleasure. And when actual exam will be 25 to 30% more easier than this. I will give those easy papers also from January first week onwards. Don't be this thing. Now I want to slightly tease you so that you need to run a little more. That's a whole idea. So this is called periventricular leukomalacia, which is classically a complication which occurs in the preterm infants, is what you have to basically periventricular leukomalacia. Then which is not a cause of the imaging findings on MRI. So what do you see on MRI? You are seeing on MRI multiple hyperintensities involving the white matter. So among the various causes, metastasis, multiple sclerosis, atherosclerosis, anything can be responsible, but not vasculitis is what you have to basically remember. Then which is not the cause of the lesion which is being shown. What is the lesion? Cupping and fraying of the metaphysis is what you are classically seeing. So it is a classical feature found in rickets, but also in copper deficiency and metaphyseal dysplasias is what you need to remember. There is a backache, soft tissues without any soft tissue swelling. However, the vertebral bodies, this is fine, but they got compressed. Any compressed vertebral body, this is compressed vertebral body, this is a normal vertebral body. Such a isolated compressed vertebral body is called vertebra plana. Vertebra plana is a classical feature of the Langerhans cell histiocytosis, is what need to be remembered. Come on, some of you are going to take MD radiology, the most dreamt branch. अगर सीट में मिले तो 2 करोड़ रहना पॉकेट में, 2 पॉकेटों मिला के, नहीं तो अब्बा के विल्ला को बेच के एमडी रेडियोलॉजी में सीट लेना पड़ता. अब्बा कभी नहीं देगा. मामा जी के विल्ला को टारगेट करे तो पिल्ला के साथ, then you will get MD radiology. Otherwise you need to read well now. So be sure. Then doctor, a young male presented with an itchy rash on the buttocks and groin, which are being shown. So classically you find a central healing with a peripheral, with a central clearing. So it is a classical feature which is a feature of dermatophyte infection, tinea is what need to be remembered. Now what is the classical phenotype you are seeing? Marfan. So it is the fibrillin which is abnormal. How many of you answered collagen? Please. Wow, I'm waiting for some appreciation from you with wrong answers. Right, fibrillin, famous wrong answer, collagen. Tomorrow when you come for the pathology DNB session morning to evening, we will find, we will give you a lot of mnemonics to remember also, because pathology and pharmacology has dirty lists of mnemonics to be remembered. I mean list to remember, that's a whole challenge. 17-year-old presents with lesions as along with superficial scaling, altered pigmentation is there. So if it is not clear in your this thing, are they giving it in any link, online link? They didn't give on a online link, nahi de rahe. अच्छा लास्ट मोमेंट टाइम नहीं मिला. नहीं, एक ऑनलाइन लिंक in the news for medico we will put all the images so that on your smartphone you can go through the images if the clarity is not there in the paper. पेपर में फोटो डाल के देना बेकार है, क्योंकि after the exam is over you will anyway throw it away and it's costly affair. So that's the reason we will give it as a web page. Sometime time नहीं मिले तो our people didn't do. Classical of pityriasis versicolor. वाईफाई पासवर्ड 3G है ना हर एक मोबाइल फोन में. अरे 100 रुपीज डाले तो एक 3G मिल जाएगा मेरे भाई. 100 रुपीज देना है तो बोलो वो दे देंगे. तो या so I am very honorably presenting a paper in Istanbul, Turkey on October 15th, a paper accepted in an international forum of medical education that in India medical students take mock tests on mobile phone and attend from home, thousands across the country on the platform. So entire world is going to listen my presentation in Istanbul. Mainly our Middle East and Gulf countries. So don't tell that 3G is not there in the phone. I'll be disappointed. Abhi cancel karunga ticket Istanbul jane ka. So that's the point, doctor. So topical antifungal. So what is tinea versicolor is because of Malassezia furfur is what you need to remember, and topical antifungals will help to treat the Malassezia furfur. Dermatology very achievable subject. 15 topics only dermatology. Each topic के ऊपर 25 points. 400 points मालूम है तो 10 marks in DNB, 5 marks in state interest. Pocket में है. आराम से scoring subject है. So what do you see on his cubital fossa? You are finding the lesions and also involving the face. So the exposed areas are the ones, the flexural creases are the ones which are typically involved whenever there is an atopic dermatitis is what you have to basically remember. A young adolescent has multiple lesions like this. I think this everybody would have answered, a little easy question. Comedone is what you are finding. I didn't ask it white head or black head at least. So comedone is what you need to remember. Then doctor, 34-year-old from Nizamabad has left hemiparesis. HIV antibody was positive and neuroimaging is showing multiple lesions. So what is the most likely cause of multiple enhancing ring lesions? Toxoplasma is the most common underlying cause is what you have to basically appreciate. So the deformity which is being shown, what is this called? Penicillin cup appearance. is what is the other name given for it. It is also called as opera glass deformity. Opera glass deformity or penicillin cup appearance, which is classical of psoriatic arthropathy, also called arthritis mutilans, is what you have to basically remember. Then the radiograph has been shown to you. What do you see here? It looks like a picture frame where you can put the wedding photograph in that. I mean, wedding time में नहीं है, अभी wedding के every anniversary को एक साइड बन गया और 4 years और 10 years में picture frame बन गया. So that is a typical picture which is seen in Paget's disease, is what you have to basically remember. Then regarding the radiograph which is being shown to you, you can see the Z deformity, etc., which is classical of rheumatoid arthritis. Z deformity and phalangeal subluxation, etc. So eccentric swelling will be there, asymmetric distribution, rheumatoid, no it is, they are not the features. It is symmetrical arthritis, female predominant, and if excessive physical activity is there, it can lead to more severe forms of joint disease, is a true statement. Regarding the condition shown in the radiograph, what do you see here? This is called tibial spiking. Such a spiking of the tibial osteophytes is a feature of osteoarthritis. So what is the true statement about it? A true statement. All the others are all true statements, but tibial spiking is a early feature, not a late feature in case of osteoarthritis. 29-year-old comes with a thyroid swelling, discrete thyroid swelling. Young, sweet looking female student nurse has come to you as a patient. So she is worried that why the swelling is there. Is it the age for any malignancy? But she has got a lymphadenopathy, cervical lymphadenopathy. And what did the radionuclide scan show? Cold nodule. So more likely to be a malignant one. Which malignancy of the thyroid presents like a swelling along with lymphadenopathy? Papillary carcinoma of the thyroid is what you have to basically suspect. A 62-year-old from Visakhapatnam, long period worked as a boiler lagger. So boiler industry में अगर जो काम करते हैं उसका एक्सरे में bilateral basal fibrosis is there. Classical of asbestosis. Asbestosis versus silicosis. Which involve upper lobe, which involve and co-worker pneumoconiosis. A तीनों में which lobe is involved is a favorite question of the examiner. Be very sure to review. Anyway, day after tomorrow when you come for the SPM review, DNB SPM marathon from morning 9 to evening 8, we will try to finish which lobes are involved in which pneumoconiosis. Now doctor, elderly patient presents with a painful vesicular rash on the face. देखते ही बोल सकते. What is that called? Herpes zoster, ophthalmicus, which is a reactivation of the chicken pox, is what need to be remembered. 64-year-old with fever and altered sensorium, elderly person. Which lobe is involved? Temporal lobe is involved. So temporal lobe encephalitis is a feature of herpes simplex encephalitis, is what you need to basically remember. So what is a true and a wrong statement about herpes simplex encephalitis is what you have to be very sure about. A farmer admitted with depression and overdose was there, hypersalivating, disoriented, and how are the pupils, doctor? Constricted. So meiosis, so organophosphor poisoning is what you have to basically remember. 35-year-old woman, painful lower limbs as shown in figure. What is this? Unilateral swelling whenever is there, DVT or cellulitis. Two possibilities, but DVT is a likelihood here. And which agent she has been using for the breast cancer can lead to complication of the DVT is the challenging question in this case. It is the tamoxifen is what you have to basically remember. Tamoxifen Then a 27-year-old right hand dominant man has right distal radius fracture after a fall. So which radiographic parameter has the greatest bearing on the ultimate outcome? It is a palmar tilt which has got the highest bearing. Where do you use Bowman's angle? Which fracture? Supracondylar fracture of the humerus in children. We use the Bowman's angle is what need to be understood. 23-year-old, physical examination findings have been shown to you. So, looking at the physical examination only, you must come to conclusion. You should not require a radiograph to show it. Classical in posterior dislocation of the hip joint. So, what do you get in posterior dislocation of the hip joint, doctor? Flexion, adduction, internal rotation. Let us see. You have a flexion, adduction, you look at the foot, then you will decide internal or external. Internal rotation is a classical feature of posterior dislocation of the hip, and it is also called a dashboard injury. Sciatic nerve injury can occur whenever posteriorly it dislocates, and femoral head can undergo osteonecrosis if you don't salvage it. And that is the reason if the patient comes within 6 hours, closed reduction is what you need to do. You need not cut and do open reduction. That is the point about posterior dislocation of the hip. A 45-year-old involved in motor vehicle accident, a radiograph has been shown. Once more, what do you see? The femoral head on this side is no more in the acetabular cavity. It got dislocated. Classical once more of posterior dislocation of the hip. So what is the most likely concomitant injury that you will find? It's a dashboard injury, posterior dislocation. It also hits the knee joint, and anterior cruciate ligament tear is an associated injury. Whenever there is a traumatic posterior dislocation of the hip is what you have to basically remember. 42-year-old comes with right hip pain, and there are no other neurological symptoms, and the right hip, what do you find? There is a undisplaced capital fracture of the femoral neck. So how do you want to basically manage in this given scenario? Percutaneous spinning you can do if it is an undisplaced transcervical fracture is what you have to basically remember. 66-year-old had a fall and his radiograph has been shown to you. What do you see here? Here it is a displaced fracture and his age is 66. So what do you want to basically do? Total hip arthroplasty is the one which is basically indicated. A 72-year-old sustains a injury and the radiograph has been shown to you, and what do you see? Completely displaced subcapital femoral neck fracture. Displaced subcapital femoral neck fracture is what you find. So whenever it is there, what is the flexion? External rotation is the attitude in case of a displaced subcapital femoral neck fracture is what you have to remember. A 80-year-old had a mechanical fall on an outstretched hand. So what do you get? Here you are having a fracture. How many pieces it is called? 1 piece, 2 piece, 3 piece. That's how upper part of the humerus fractures have been divided. It's a 1 piece fracture. So what is the management of 1 piece fracture? There is no need of any surgical intervention. So you need to do sling immobilization followed by early range of motion is what need to be remembered. Okay, doctor? Then sagittal T1 weighted spin echo MRI of the thoracic spine has been done. So what do you see here? You find a tumor which is showing a dural tail. A dural tail of a tumor is a feature of meningioma. So what are the true statements about the meningioma? Dural tail sign is seen commonly in the dorsal spine, that is the thoracic spine. It will show contrast enhancement, but calcification is uncommon in spinal meningioma. But cranial meningioma may calcification is common is what need to be remembered. Remember, brain tumors is a common topic for pathology, pediatrics, medicine, Radiology, when in so many areas it is a high yield topic and top list. You should not ignore everything, you must know about it. Okay, doc? Quickly tell me. Huh? Where? Huh? Spinal meningioma is most common in which location? That's the point. Because we are showing a spinal meningioma to know. That's the point. Intracranial, you are right. That is classically parafalcine area is the most common location. Moderate contrast enhancement is a feature. Here contrast is not yet given. Right? So, now what is the commonest lesion for this location of the tumor in the children? What is this location? It is intramedullary. So tell me, doctor, what are the tumors? Two tumors which are common in intramedullary. Fatapat below. Sing along the answer. Glioma, ependymoma are intramedullary. What are the two tumors which are common in extramedullary but intradural? Come on, doctor. Dr. Murli Bharadwaj students means तलवार के तार के जैसे आप चमकते रहे ना entrance में, and you have to kill the you must go with the killing attitude. If not me, who else will get into the top 100? That should be the goal. Okay, so anyway, intramedullary, what are the two tumors? Don't forget, doctor, ependymoma and glioma, which is also called astrocytoma. Then outside the medulla but inside the dura, called extramedullary intradural, two tumors, neurofibroma and meningioma. And outside the dura, all the tumors are basically metastasis. That is what you need to remember confidently, doctor. So what is the common tumor in this location? In children it is astrocytoma. 1 minute. Answer should be A. Please change. Please change. Oh, sorry. In adults is ependymoma. In children is astrocytoma. Okay. Brucellosis versus tuberculosis of the spine. How do you basically differentiate? Whenever you are having a MRI, is a very important and a challenging question. Lower dorsal, upper lumbar. Lower dorsal and upper lumbar vertebrae are involved means it favors TB. Whereas all other features, bony destruction, paraspinal abscess, loss of the disc height, involvement of the intervertebral disc, they are a feature of both the TB and also brucellosis. So they are all the, similarly, how do you differentiate? Spinal TB from spinal metastasis is something that you need to very surely differentiate, which we discuss in radiology. Now, doctor, which is not seen in this condition. Basically, what is this condition? In this condition, you are finding lot of osteophytes, which is classical of spondylosis. So, spondylosis may, you will find Schroemel's notes, osteophytosis, subchondral sclerosis, and is what you need to remember, not end plate osteopenia. Then what is this osteochondritis which is involving the vertebral body is called as Scheuermann's disease, is what need to be remembered. So one of the predisposing factor is a vigorous exercise is what you have to basically remember. Now what do you see in this radiograph? The Scottish Terrier dog sign, where it looks like the neck of the Scottish dog has been broken. Whenever spondylolisthesis, slipping of one vertebra over the other is there, then you will find a B-headed Scottish Terrier. Basically in Scotland you got a dog which looks like this, Scottish Terrier, its neck is being broken, kind of a imagination you should have. 75-year-old man, ischemic heart disease, previous alcoholic abuse, deterioration of the central vision in the right eye. So what is that which it is showing? Classical of optic neuritis. So optic neuritis or macular degeneration, either of them. So central lesion means macular degeneration. So it's a classical case of a visual field defect which you see in macular degeneration. 70-year-old with frontal headaches and weight loss. What do you see on visual examination? What is this finding called? Bitemporal hemianopia. So which of the following suggests the diagnosis of a pituitary tumor? In this case, generally prolactin high, prolactinomas are the ones which lead to development of the bitemporal hemianopia. 23-year-old comes with a spastic gait and blurring of vision. Fundus examination has been shown to you. Spastic gait and blurring of vision. Blurring of vision because of optic neuritis. Okay, so how will you explain blurring of vision, ataxia, spasticity, all the three? Multiple sclerosis, which is a demyelinating lesion where the lesions are spaced by virtue of geography, that is the anatomical spacing, and they are all separated by time. They all don't occur same time, they occur sequentially. That defines multiple sclerosis. Lesions separated by the geography of anatomy and by the space of time is the definition of multiple sclerosis. MRI is the best way. Now you have done a fundoscopic examination. What do you find? You find capillary hemangioma. So capillary hemangioma is a classical feature of VHL, von Hippel-Lindau syndrome, where you have capillary hemangiomatosis involving the retina and also cerebellum and the spinal cord is what you have to basically remember.